And we're live.
All right. Well, hi, welcome for joining us. I have myself here, Tiffany Minnick and Jim Kane, and we are both physical therapists for different aspects of TheraPlay. So I'll tell you a little bit about myself first. I have been a PT since 2006, so just coming on 15 years, and I've had my whole career at TheraPlay. So I've kind of moved up the ranks from a treating therapist to a PT coordinator to now a center manager. So I manage our Horsham outpatient location. So my role is to oversee the location as far as the outpatient is concerned. I'm also a treating physical therapist. So I do still treat patients as well. And we are the medical-based approach of the company. So we bill your primary insurance. We don't have to have a specific delay to qualify. There's a couple different things we'll chat about today so that we can keep everybody, in the loop of how we can work together, how it's a little bit separate as far as the medical-based and the early intervention model. Jim, do you want to tell them a little bit about you?
Sure. Thanks, Tiffany. My name's Jim Kane. I'm a physical therapist as well. And I'm kind of the old head at TheraPlay. I've been here going on 24 years, mostly doing early intervention, have done some outpatient as well, but for the most part, early intervention. So like Tiffany said, we're going to talk a little bit about the different models, how early intervention differs from outpatient therapy, and then also how it can kind of work in conjunction with. So, I think it's going to be a good discussion.
Yeah, and I think we can kind of start from the beginning. So a lot of, parents watching might get from their pediatrician, and early intervention, we're kind of focusing on that birth to 3 age. So when you would call, the early intervention, maybe they have a delay, they're not crawling, they're not walking, or they have, a muscle that's tight in their neck that's known as torticollis. And so your pediatrician might say, oh, I really think they need physical therapy. Let's do some early intervention. So that could mean a couple different things. So early intervention as just itself as a phrase is let's get services early, but that can mean outpatient, medical based. It can mean early intervention in the sense that they come to your house. So I can tell you a little bit from the outpatient perspective on how that might look. So your doctor may give you this information and you might be confused as to, okay, they gave me all these different numbers. Who do I call? So from the outpatient perspective, you would call one of our centers that's closest to you. We would get information, demographics, what you're looking for, schedule you an appointment. We also do the sessions and bill them through your primary insurance and a secondary if you have one as well. And so that's a little bit different for outpatient. We go through the insurance as far as if you have a copay or deductible, things like that. In a medical-based model, we also tend to be a little bit more aggressive in our treatment. And so our model is more hands-on. We do family education and home exercise programs, but you coming into the center, you bringing your child, and then we're doing the session mostly hands-on with them, having the family try a few things. We may see them 2 or 3 times a week initially because we really want to get in there. We want to be a little bit more aggressive, where the early intervention model, as Jim can tell you about, is a little bit more education and teaching the family, checking in with them. So the frequency might be a little bit different as well. I don't know if you wanted to touch on that a little bit, Jim, from the beginning.
Sure. From the early intervention perspective, it is a little bit different because there are referrals that go out. Usually a doctor or someone from the hospital, social worker, could be anybody, could be someone at the daycare recommends, hey, maybe you should look into early intervention. And then the families will look into early intervention, they'll make a call, and they'll get an evaluation set up. There's an evaluation team that is a separate entity than treating teams with early intervention. They like to keep that separate. And they'll do an evaluation and determine whether or not the child qualifies for early intervention services. And that can be any number of services that you're looking at: PT, OT, speech, special instruction, behavioral. They even have nutritionists. They have a little bit of everything that can come out to work with early intervention. But the model is a lot different than the outpatient model. So it's a teaching model, and you're based more on instruction. There is a certain amount of hands-on from the therapist. I mean, obviously you have to get to know the child. You have to feel their tone, their strength, their movement patterns. But then at that point, it shifts. It shifts to the parents are doing a lot of the therapy and the therapists are kind of coaching them along. And with regards to that, you want it to be in their natural environment. You want it to be it can be in their home. It can be in a daycare setting. You can meet at a park. You can meet at areas in the community outside of the home. And you also want family members to be part of it. So parents are not the only ones that can be present during a session. You can have siblings, you can have aunts, uncles, cousins, babysitters. Anyone who's a part of the child's life can be present at the session because we want them to also learn, the strategies that we're using, and we want them to be able to incorporate them into the time that's spent with the child. So it's a little bit different from that perspective. The other thing that's a little bit different, frequency is a little bit different. In the outpatient model, you're going to get probably a little higher frequency if the child qualifies. You could be looking at 2-3 times a week. In the early intervention setting, chances are you're going to be seeing at most maybe once a week. It just is a different way that it flows. And that's why sometimes I think it's good if the two can work together. If maybe a child is getting once a week in home, but maybe there's additional therapies that could be utilized. It's nice to be able to utilize the outpatient setting as well. And we'll make recommendations for parents to go seek out those types of services too.
Yeah, and we do the same in outpatient as well. So every patient that comes in that is, birth to 3, we give them early intervention information, because just like Jim said, it's great to have that overlap. So maybe, each county is different with how quickly they can get your child in for that initial evaluation. So maybe, if it's 15 days, but you really want to get in and you call outpatient and they can get you in 2 days, maybe you start an outpatient. You see how early intervention works in. Does it work for both? I can get to that outpatient center. I can bring my child, but I really like that PT or that OT or speech therapist to go to their daycare, because I want them to see what they're doing as well. So that combination may work good as well. Maybe once a week for early intervention, once a week for outpatient. And sometimes we have families that just start with both, and maybe one works better. Maybe, mom and dad are working and it's really hard to get in, and they have 3 other kids that are now doing activities in the springtime, and they would just rather someone come to their house, come to the daycare, and that's okay. Mm-hmm. As long as they're getting that service somewhere, we don't mind that. So right. Maybe it's outpatient, and, grandmom lives right down the street and really wants to bring, the kiddo and likes to be in the session and see what's going on, and they've come to outpatient because they're 5 minutes away. So like Jim said, I think that working together, communicating, I think communication is big too. And I'm sure Jim would agree. In outpatient, we love to know if you're already getting early intervention. Let us know. Are we able to talk to that therapist? Can we coordinate it? Make sure we're on the same page, doing the same activities. I also think it's great too for things like orthotic management and equipment management to make sure we're on the same page. A lot of that goes through insurance. So that's a little bit easier in the outpatient system to just move a little bit quicker as far as doing that as well. I think Jim would agree. I see him shaking his head a little
Absolutely,
bit.
Absolutely. It's one of the best things actually, is because we know that we can get those things kind of accomplished more quickly. Sometimes if we have to leave it up to others to kind of, seek out those types of things, especially for medical equipment and for orthotics, it's a little bit more difficult. But if they're already being seen and, maybe an orthotist is coming around to the clinics, you can time it, when they're there. So things do tend to get done a little bit more quickly there. The other thing that's really great about being able to have both is it's completely different settings. So you may find that by going through the process that one setting works better than the other, or that they both work really, really well, but a child gets to use all the equipment and get all the benefits of the equipment that's in the outpatient setting that they don't have at home. And then we can try to even see, okay, well, what's working in the outpatient center, and how can we kind of make that work with something that we have in the home setting? So they do kind of go hand in hand and really do work well together in a lot of cases.
Yeah, and I think that some parents too, like I said, might be confused when your pediatrician gives you that script and just says, here, call early intervention, but you have all these numbers. So, ask the pediatrician, you can call early intervention, you can call your county, you can call outpatient. We can talk you through it if you have questions before we even schedule anything. It just really depends on what works best for you. If you want to try both, if you want to try one. I also think something that Jim mentioned when he was talking about the early intervention through the home is the qualification system. And so early intervention and outpatient are a little bit different as far as qualifiers. So, and I believe this is right, Jim, it's a 25% delay technically for.
Yeah, thereabouts, yes.
Yeah, so when
different, criteria, but yeah.
So there's different criteria. That's a great way to put it. So early intervention in the home through the county has specific criteria to qualify a patient. So maybe your little one is 8 months old and they're not crawling, but they're sitting, they're getting up on their hands and knees. And so they're technically still on par for their skills, but maybe when you bring them to outpatient, we notice they only go over their right hip. And so that's something we can kind of dig into, that more nitty gritty, piecing it together. We can address that medically. So it's not that they can't do a skill, it's just that maybe they're asymmetric, or, they're only doing it sometimes, or they're pulling one leg up and not the other. And so we can look a little bit more into that. So parents sometimes I think maybe a little bit frustrated when they're recommended for early intervention. And they're like, well, no, they're actually doing okay. And they are, but maybe they just need a really short bout of care for a couple of weeks to get in, teach the parents what to do, cue this, and then all of a sudden they're great. And so really that wasn't a patient that necessarily needed that full, evaluation and early intervention model. So it's a
Just
little
need a
bit like
little
that.
boost. Yeah, sometimes they just need a little boost. They just need to
Exactly,
and then
right.
they
And I
take
think
off.
that's a great way for
Yeah.
outpatient.
Yeah.
On the flip side, like I said, we always give that information for early intervention. I think some of those kiddos and patients that have more of a long-term diagnosis or something that is going to take a little bit longer to get that earlier intervention involved is so important through the county, because I do think, like Jim said, the overlap of the models just works so nicely for coordinating care, just a little bit more holistic. And we can do OT and speech and outpatient too. So we've had patients that receive multiple services in outpatient and early intervention at the same time, which I think is great if the family can handle that. Again, whatever works best for the family, as long as they're getting some type of service, we're happy for them.
Yeah, that's always the toughest thing, I think, sometimes for families, is finding the right balance. Because sometimes, somewhere in their life has to take place too. And they have to they have responsibilities, they have other kids, they have, many different things on their plate. And it can't always be, that more is better. I think that a lot of times it has to be the right amount. It has to be what works. And I think most families that do seek out early intervention services as well as outpatient services are really looking to do the best they can for their child. And sometimes it can be overwhelming if they're getting recommended for so many different services. And in many cases, they try to balance it all, and sometimes it just doesn't work. So you almost have to take a step back and say, okay, well, what can we really do that works for our entire family unit? What can we do that's going to be best for our child? And somehow find a balance in there too, and make it work. And that's what's really nice about having, both worlds, I think, is you can. Sometimes it can be a lot if someone's constantly coming into your home, and sometimes it's nice to be able to go, okay, I'm going to take my child to outpatient. They are going to work with them. And I might even have a chance to look at something in my handbag, or, check out my schedule and see what's going on, rather than having to be on every time a therapist is in my house. So, there's definitely give and take. And I think that everybody kind of, can take a step back and can look at, okay, what's going to work best? What's going to be the best situation for us?
Yeah. And I think families should feel comfortable to say that. So maybe they're in outpatient and they can say, you know what, I called the county and we're going to do early intervention. Really, that's what's going to work best for my family. We say, okay, great, no problem. If you start before you end here and you want us to kind of touch base with where it's going on. And I'm sure the same for early intervention. If they say, you know what, this isn't just working for me at home. We need to get in somewhere because it's on my schedule and that makes me do the activities and, focus on it every week. And, I want parents to feel comfortable that it's okay to talk to your therapist and talk those out, communicate. Yeah. We are here to help you and your child make that best outcome. That's, everyone wants the same thing. So,
yeah. And I'm sure you see it, Tiffany, when, you'll have some families that will come into the outpatient center and they've got 3 kids in tow, young kids, might have like 4 under the age of 6 or something like that. And just getting them ready to go to an outpatient session can be, just, a major logistic, exercise. So, that's where that early intervention model really benefits someone like that. It makes it a lot easier if it's in-house. So there's definitely situations where you can see that, either will work.
Yeah, I always joke with families that I have 2 young kids at home, and I give them all the credit in the world for being able to get their kids ready and get out the door. And like, wow, you get here at 8 o'clock, but now I have kids, so I'm like, okay, I get it. You're up early as a parent now, so
that's right. You figure it out.
Yeah, so I don't know if there's anything else anyone would want to know about the outpatient versus the early intervention model, or anything else. Questions, anything.
We could talk a little bit too, about the transition piece. So like with early intervention, obviously in the birth to 3 model, it's home-based. And then there's that transition phase when a child turns 3. So, there's that natural transition to a preschool setting and more of a center-based approach at that point. And so that's just another piece of the puzzle that parents kind of have to navigate and have to understand early on too, that it will change, that home care doesn't just go right up to school age, that it does become a shift that goes into a center-based type situation right at age 3. So just to throw that out there too, that there is that piece of the early intervention puzzle. Where it
Yeah,
does
I think that's a
shift
good point
gears.
too. With that transition, maybe your child qualified for early intervention and they've been doing great and they kind of held on to them once a month for the last 6 months just to keep them in there. And now they don't qualify for when they reach 3, that 3 to 5 preschool program or doing an educational setting. But maybe mom and dad or grandmom still has concerns about something. So that could be that transition where then, okay, let's call outpatient. Let's see if we can, kind of spearhead a little bit, get in there, get a little bit more aggressive again for that kind of shorter time period. So that transition is a great thing to bring up too, that maybe they're don't qualify, but they still want to get something checked out. So that definitely goes hand in hand as well.
Right.
Yeah. I think if
We
there's
do
anything
actually, we actually have some questions that have been submitted to us. This one I was actually kind of interested to know, where does EI occur? Where does early intervention occur? Where do I go for early intervention services?
Well, you would contact the county at which you are part of. That's who runs the early intervention services. Each county in the state has their own programs, and they're allowed to, within state guidelines, are allowed to run their programs the way they wish. And that's where you would contact whatever county you're in. You would contact the county, and you can look up early intervention on the state websites as well. And we could provide that information for anybody who would need that.
And I think you both sort of touched on this theme already a little bit, but I think it's important to go back on and talk about again. Can my child receive early intervention and physical therapy services at the same time? And then a second part to that, what if my child doesn't qualify for early intervention?
Okay.
Yeah, so I can talk about the same
Go
time.
ahead, Tiffany. Go ahead.
Yeah. So yes, they can. The outpatient model is based on billing your insurance. And so that's completely separate from the early intervention. Early intervention is a county-based service. It's free to families who qualify for it. We probably should have thrown that in there as well. And so it's completely separate. You don't bill your insurance for home. We bill your insurance for outpatient. And so therefore you can receive both at the same time. Like I said, we had kind of said, we encourage that if that's the case, if you're looking for both, or to pick what works best for your family. And then the other part was forgetting the other part of the question.
What if my child doesn't qualify for early intervention?
Right. So they
Yeah,
can
and
come
that,
to outpatient.
that happens, quite a bit, because it seems as though it is a little bit more stringent as far as, you have to show the delay that the county is talking about with regards to qualifying for services. So, if they are evaluated by the evaluation team and it's deemed that they don't fit the qualification standards, then they're not going to be referred for services. And at that point, that's when you would look for other alternatives if you still have concerns. And the obvious point would be the outpatient centers.
Okay, great. Well, I don't see any more audience questions at this time. Jim and Tiffany, if I'd really like to thank you for taking the time today. This was really great. If anybody out there has any additional questions, please feel free to drop them in the comment section when this video posts to our Facebook page. And then we'll definitely have Jim and Tiffany get back to you if you post any questions in the comment section. And thank you both again for taking the time. This was really great.
Yeah, thank you.
Thank you very much.